Hello, good evening. This meeting is being recorded. So I just wanted to let everybody know that before we proceed. And my name's Carolyn Wing, and I work at Langara College in the Center for Intercultural Engagement. And Langara, the center, is one of the partners for this session, which is, in case you're in the right place, it's missing numbers, silence, erasure, and the damage of colorblind data. I'm going to start things off with a territorial acknowledgement. I am zooming in from the traditional and unceded territories of the Squamish, Tsleil-Waututh, and Musqueam people. And since we know that everyone's zooming in from all across the province and maybe even across the country, we just like to take a minute and pause and have everybody just acknowledge the territory that they're in. And usually how I like to do that is really for you to think about if you actually have a window in your room where you're zooming in from, to take your eyes off the screen for a minute and look out the window and look at the land. And if you don't have a window, just envision yourself right outside your front door and place yourself on the land and just take a breath and a pause for a brief moment and acknowledge the traditional and unceded territory of the people that have been the stewards of that land since time immemorial. Thank you for that. And then we're ready to start now in a good way, and I will ask Sarah to start us off.
Good evening and welcome, everybody. It's really a pleasure to have all of you join for this second part of a series on data collection and we're very grateful to all of our sponsors and collaborators who have contributed to the development of this series, which includes the Dr. Sun Yat-sen Classical Chinese Garden, Langara College's Center for Intercultural Engagement, as well as the Chinese Canadian Historical Society, which I have the pleasure of being the chair of. And so without further ado, I will introduce our moderator. Again, this follows the first talk that we held 2 weeks ago, which was called Negative Numbers, and looked at the history of control, surveillance, exclusion. It was very well attended, and if you happen to miss that dialogue, there is a recording on our CCHSBC website. But here again to lead that discussion and the great dialogue we started is Dr. Henry Yu.
Thanks, Sarah. Thanks, Carolyn. And I wanted to thank our speakers today. We have 3 speakers that are going to address an issue that we really started dealing with and discussing in that previous negative numbers talk. Again, just to echo what Sarah said, is that if you didn't get a chance to watch that, it really is worth going to and seeing it online and getting recording. Tonight will be also recorded, so if you wanted to share, the discussion tonight because you found it valuable, it'll be up hopefully in a couple days at the same website at CCHSBC, the CCHSBC website. So again, I want to just get to the speakers right away. Their full bios and intros are online, so I won't do the silly thing of reading them all out. But just to give you the order that June Francis, Dr. June Francis from SFU will be speaking first, and then Amy Go will be going second, and then Ellen from Project 1907 will be the third speaker, and then each is going to talk for about 10-12 minutes and share some of their insights and wisdom and experience, and then we're going to have a bit of a discussion amongst the 3 of them for as they respond to or bring up ideas that were triggered by something one of the others said, and have a little bit of discussion that way. Then we're going to open up to questions from the participants here on Zoom. So if you have a question, please type it into the chat, the Zoom chat. If you don't know where that is, it's on the bottom of the screen under chat. And what will happen is Sarah Ling or Rob Ho or Carolyn Wing will just keep monitoring those questions, and when we get to the point of question and answer, they'll grab a couple questions, introduce into the discussion for the speakers to answer. Unfortunately, we may not have the time to get to all the questions, but again, if they're written in the chat, they'll get recorded as well, and hopefully we'll find a way to at least address as many of them as we can during the time we have together. But just as a quick, for those again who missed the first discussion, I think a lot of interesting, important ideas came up, and I won't try to, in a comprehensive way, bring them into this discussion. But I think a couple of things that really stood out as perhaps at least learnings from that discussion were, one was that not having numbers was really a negative impact on many marginalized communities, on many, to even not be able to count. This within a long history, of course, of the use of data and numbers and surveillance to actually exclude people. And so there was this paradox that came up during the discussion about how, in perhaps response to that long history of racial exclusion and data collection, that, making numbers colorblind or deracinating them, so to speak, has created a situation where, in fact, it's very difficult for people to even articulate what is going on in terms of the things that are going on with their community, or the impact of things like COVID-19, obviously is one current moment, but violence, racial violence, racial profiling, there's all kinds of things. And so we heard from several speakers, Avi Go, who was talking about what's going on in Ontario and some of the responses that they've had. And unfortunately, in a totally planned way, we have actually Amy Go today as one of the speakers. And so Amy, for those who are wondering, we'll out them as sisters. And so they've both been very active in Ontario for decades, and we're really lucky to have both of them participants in our discussions to kind of share what has been learned in Ontario and some of the things that they're doing. Last week, we also were very lucky and fortunate to have the time of Marilyn Slett, who was the chief of Health Nation, who was, I think, raised a very important point for us to consider about who this data gets shared with, and so often privacy issues have come up in discussions of data collection, and often that's in the control of powerful institutions like the government or universities, and there's a double damage in the sense that the communities who really need that knowledge, and from whom that data is often collected, often don't know and can't, in fact, use that data to help their own communities or to advocate for change. And so in some sense, that the missing numbers, especially when numbers aren't missing, they're just kept in the control of some people and out of the hands of others. That came up as a very strong theme and issue last time. We were very fortunate also to have someone from, someone talk about universities' role, and then I think that'll get picked up again, obviously today. Who collects and under what expertise, and how do we collect and things like that. So again, for those who missed last time, I encourage you to go and listen to the really insightful three speakers we had last time. But for today, we're really, really fortunate, and we're all grateful that we have the three speakers we do have. Where, as I said, I'm going to turn it right away over to Dr. June Francis from Simon Fraser University, who's a professor in marketing, but also involved in Hogan's Alley Society and many community organizing activities that I think give her a number of different perspectives on the subject at hand. So I'm going to just pass it right over to Dr. Francis.
Yeah, we all start by being muted again. I don't know how long it takes for you to figure that one out, but I'm so delighted to be here, by the way, and I just want to thank everyone for organizing it. Again, I won't repeat the people are involved because you've been acknowledged, but I do appreciate being here. I had a chance to listen to some of the previous speakers. Very critical points were raised, very interesting points, and I too would recommend listening to that as well. What I'd like to do today is to really bring some perspectives together as an academic and as an advocate for race-based data in particular. I came to this particular juncture primarily because of recognizing at some point I came to Canada about 40 years ago and came here expecting utopia. And I'd heard so much about Canada's multicultural experiment. And as time went by, I started to realize that what looked like exclusion for the Black community in particular was turning out to be anecdotally true, but also as we started to look at data and tried to look at what's missing and the history with which Canada has actually acted in many ways in many institutions to erase data, to hide data, and most of all, to be afraid of data. And I'm bringing you the perspective from the Black perspective for the particular reason that I think it represents a really significant erasure that can teach us all something about how politics, the politics of data, how data can harm when it's erased, how it gets erased, and what we need to do moving forward. So colored by data, as we all learned last week, leave inequities that remain unaddressed, because of course we don't know, we can't address it. The officialdom can act with impunity and pretend that there is some sort of equality of treatment when we know that there is disproportionate impacts going on. I want to point out that a lot of people have asked for disaggregated data. I think the history of data collection has been so long and has a tumultuous history, especially for Black and Indigenous people, that in fact it's more than disaggregation. It needs a lot more change than that. I also want to point out how the absence or erasure of data leads to cumulative effects of racism. And these cumulative effects become even more hidden the less data you have that's transparent to you and the way it's collected, etc. And of course, we know that they connect across the spectrum. So you want data that can start to show the complexity of the systems of inclusion and exclusion and what's actually going on. So I just want to start there by saying, one of the things we know is that in 2017, along with a long history, the United Nations came to Canada and gave a scathing rebuke of Canada on the particular 3 issues that Canada lacked intersectional data. So that's 0.93, that there was a lack of race-based data, and they were pointing out to protect the human rights of African Canadians, and made it a major point of their recommendation in coming to Canada. And the final thing is to address this holy grail of Canadian data collection, this category called visible minority, and the ways in which it acts to obscure rather than reveal. I want to point out, sorry, I should have put that down. I want to make sure that we all know, and I want to make sure that this is absolutely clear to everybody, that the refusal to collect data didn't happen by accident. This is not a benign neglect. It is, in our opinion, from our community's point of view, and I think shared by many, that it's a willful act of neglect. It's just to obscure. And it's a long history with respect to Black and Indigenous people in Canada of not collecting data that might then reveal parts of Canada's society that Canada is not particularly, I think is attractive. So I won't go through all of this, but as early as April 4th, I was being lectured by a health minister that I should not think that Canada, being a colorblind society, would need race-based data in this COVID. The Nova Scotia Chief Medical Officer later said, we can focus on those issues later. Bonnie Henry, as recent as June 18th, was refusing to do the same until recently the Human Rights Commissioner has picked this up. So the pandemic, we know, has been difficult, but that it has put a magnifying glass on a number of inequalities, including race-based data. But the key thing is to understand the depth to which this erasure was damaging and harmful. And I just want to make that the most fundamental centerpiece of what I'm about to say. So it's, in my opinion, this was sort of a life and death situation that Black Canadians and many other groups, not the only one, Indigenous Canadians, and many who we don't even know very well. I know the Filipino community here was calling out in alarm as well for reasons that were, they could understand the connections between things. So I think what is clear is that data valuation is a barometer in Canada of whose lives are valued and whose lives are devalued, right? So if you look at what happened, what Canada is really doing is using white normative behavior, white rich, middle class, and white normative, I call it. Not that the only white people live with white normative behaviors, but white normative behaviors to design the strategy that was ultimately used to try and protect us from COVID-19. So for example, when we saw things like, I'm sorry, why it's, I don't know why this just sprung forward. Okay, let me just go back. Let me just quickly say sheltering in space, social distances, issuing guidelines. So let me take all of these together. These were activities that presume something about where people live, what they live like, multi-generational assumptions, what kinds of jobs that they had to go back to work with. We all know these things. We all knew it from the beginning. But for example, PPEs. We all knew that some people were getting PPEs, others weren't getting. But without the data, the system did not respond. And what did we find? We were right to be afraid. We were right to be anxious. Why? Because when you look at the actual data that emerged, what you find was that in Toronto, which is the only place that quickly started collecting data after much pressure. Now we're calling for it from early April, and this is now starting somewhere in June, late June. And even now, this is more aggregate data. But what do we find? Exactly what we feared. That if you look at an area like Weston in Toronto, about almost 35% of the these are the top 5 areas where COVID-19 hit. These are the highest impacted areas. What you also find if you look at visible minorities, and this chart looks particularly at the Black population, extremely overrepresented, right? So you're looking at 35% in these areas, a Black community. As a percentage, it's about 8% in Toronto. So these are areas, all the top 5 areas, overrepresented with COVID, overrepresented with the Black community. You look at some recent data that we collected, and what do you find? That in fact, the United Nations was right. Law enforcement is an area we've all talked about, the lack of data, and we know that Ontario is about to collect some of this data. But if you look at this is quite interesting. This was some survey that was taken in the middle of the pandemic and in the middle of Black Lives Matter. And what you find if you look at this data, it's like, if you look, this is Black Canadians, right? And the question was asked, do you feel safe in your interaction with police? And you find that if you were to put this as a visible minority category, it would obscure the significant ways in which, imagine this, only 42% of Canadians who are Black identifying feel that they are safe in the hands of police. I'm going to skip over a few things. If we have time, we'll talk about some more of this. So how have we used data to be silenced in Canada? We're all familiar with the lack of data, just not collecting it. But we obscure it. We use terms like visible minorities under the Employment Act, which often obscure rather than illuminate. But I want to talk about things like the instruments that are used. I have been looking at Stats Canada data for some time, recognizing that the normative assumptions of the questions that are asked, the way the questions are asked, which questions are asked, how those questions are interpreted, are so white normative that they really don't get at the heart of the issues that may be relevant for all the other communities. For all other genders. They're also very patriarchal in their orientation. Also, they don't collect data across the board so they can be comparable. And official data, if you try and go back in time and collect data, for example, the example I'll give you is Ho-Gonzalez Society. If you try and collect data on Ho-Gonzalez Society, what you will not find is census or any other official account that has taken account of the Black population that was in Vancouver. And the reason for that, of course, is that Black lives did not matter. And so counting them was not an important thing. Again, complete erasure. This is some data I collected here myself, and I just want to show you why I think this continues. I think there's an hegemony, we all know, in terms of who collects data across organizations, across institutions, across sectors, across educational continuum. So this is some data I've collected on visible minorities on governance boards in Metro Vancouver. The orange is the white, the blue is the visible minority categories. And for your reference, I put here, the comparisons. So in Richmond, 76% are visible minorities. Almost all municipalities have at least 50%, and yet we see a domination of one group still. So I think another group, Ho-Gonzalez Society, I'll just end here because I want to leave time for others. We need to recognize that some groups are completely ignored. Vulnerable groups like the homelessness, getting race-based data in homelessness. We have worked for 2 years now and still don't have a proper way to do this. I think I'm going to stop here by saying that we need transformative change. And I think it goes well beyond just a race-based question. I think we have to think about the assumptions and worldviews of what's behind data. I think we have to make sure that we look at how data has been historically excluded and how we can recapture data that was excluded in the past because it was used to exclude. I think we have to recognize that it needs to start to devalue some people and revalue others. In other words, decenter. I don't mean to reduce their value, just take away power from only one group. I think we need to ensure that at the very top of institutions and data collection machinery, and in terms of community ownership, that the communities become centered again. And there are many methodologies for doing that. We need to reimagine and re-engineer everything about the research industrial complex, I call it, and that the data has to be co-created now in 2020. It's no longer the purview of one group. So I think we have to shift power. And I was a little bit distressed when I heard that the Governor General was talking about having consultations with community, but the way she's talked about it was, sorry, not the Governor General, the person, I'm trying to finish, but you know who I mean, is about to collect our data in Vancouver, in British Columbia. human rights commissioner, in the sense that she said that, she'd consult with us, but I got the sense that the real decision and the whole approach will be through her office. We need to learn to really co-share these opportunities. Thank you.
Thank you very much, June. And I'm glad that you've laid out in a very thorough way, I think, some of the challenges of moving ahead. That it's not just a matter of saying, okay, here's what's missing and let's fill the gaps. It's the very approach, the co-creation of the process, data ownership, the categories. In some ways, it's really important that those who understand data, really are here discussing the challenges and what to avoid, so that we're not just replicating, in some sense, the processes of the past. So thank you so much, Dr. Francis, for sharing those perspectives. I'm going to move on. We'll move on to Amy Go. Again, she's coming for 8:30, I believe, in Ontario time. So thank you so much for staying up a little later than the rest of us to join us. That she's had decades of experience as a community organizer and an advocate, and in many ways, as we heard on the first session from Amy Go, that Ontario has actually implemented a number of legal as well as institutional tools and processes, I'm sure those in BC don't like to think of it that way, but Ontario has perhaps responded with a little bit more urgency and alacrity than we have here in BC to some of these issues. And so we're really looking forward to hear from Amy about the work that she's been doing and the organizations that she's been involved with that have pushed some of these issues to the fore as well. So thanks, Amy.
Thank you very much for this opportunity. Again, it's truly an honor to be with such esteemed colleagues in Vancouver to discuss very important topic. What I'm going to do is actually focus on based on my experience in long-term and community care, and share with you how I see data collection and missing data from that perspective. And in fact, a lot was already actually spoken about and raised by June. So hopefully I'm not repeating too much of what June said. So I'm going to use long-term care as an example. The reason why in Ontario in particular, almost half of the deaths are attributed to seniors and residents who live in congregate living, either in nursing home, we call them long-term care homes in Ontario, or retirement homes. And so there is a lot of attention paid to long-term care, the deplorable conditions, the lack of staff, the total lack of attention to the needs and care of these vulnerable seniors was definitely raised in this COVID pandemic. Unfortunately, though, in spite of all of that, the Ontario government is pursuing to open more long-term care homes, while they actually promised to start a commission to look at the reasons and the causes of all these trauma and tragic deaths as a result of the lack of infection control measures in long-term care homes. So using this as an example, I'm just going to share with you and try to answer some questions like how government uses this data to justify its decisions and actions, and what are the data that they are not being used, they are collected or not even collected by authorities, and who benefits. And in fact, that June actually has talked a lot, but I would just very quickly look at that and then look at whether the issue of disaggregated data will help address some of the issue, systemic barriers in healthcare. So as I said, Ontario governments have decided and have committed $1.75 billion to add 30,000 long-term care beds over the next 10 years in Ontario. And then recently they said, we're going to fast track and we're going to construct another, 640 new beds in a year. And then, so how they tried to sell this was that they said there are 38,000 people waiting for long-term care in Ontario. Altogether, there are 626 Ontario homes, and there are 78,000, but in fact, almost like half, more of the people are waiting outside and still not being able to get in. However, though, they are not, the data that they use is like long waiting list, and also the Premier has used the term hallway medicine many times during his election and after subsequently in his time as the Premier. Hallway medicine refers to emergency rooms and beds all over the hallway because there's simply no bed in our hospital to admit those who need to be admitted. And so these people are stuck in emergency room. And then here in Ontario, we have this called alternate levels of care. These people should not be in acute care. They are not suitable in an acute care environment, however, because they have nowhere else to go. So there are over 5,000 ALC beds in Ontario hospitals, and approximately half of those, like slightly less than half, are waiting for long-term care homes. So the Ontario government said, given this data, we should build more. But they are not sharing you the data that even, that we know in healthcare, and actually some of the data is available to the public. For example, Canada has 70% less hospital beds than the average in OECD countries. And Ontario then further has less than national average. So if you don't have a strong acute care sector, that means you should have a strong primary care and community care to support people. But unfortunately, we don't. So hallway medicine is going to be here to stay, whether the government is going to build more long-term care beds or not. And over 50% of the ALC patients, in fact, are not waiting for long-term care. So even if they build more, there will still be over 2,500 people, at least in our acute care setting, waiting for somewhere to go. And long-term care sector in Ontario is overwhelmingly privatized because, in fact, of the previous Conservative government put in a policy where just, allow more and more privatization of that sector. It is a privatized sector to begin with, but what I'm talking about is the for-profit chain operator dominating this sector. So 57.7% of the operators are from these chain operations. So, but if you look at the data that people don't talk about are who are in our long-term care. So when I was, when we are all paying attention to the tragic deaths of the seniors in long-term care, CBC every night would profile somebody, a tragic incident, a grandmother, a grandfather, how they have contributed to society, and then they died lonely in a long-term care home because their family member could not go visit. So, but usually, if you look at all these reports, these are white faces. These are white English-speaking seniors in those long-term care homes. You don't really see a lot of Asian-looking or racialized communities or Black, Canadian seniors or other groups. But in fact, we actually don't know how many out of these 78,000 seniors are racialized communities, because there is no publicly accessible data, and we don't know how many on the waiting list are from what communities. And so, however, though, anecdotally, because I come from the sector, I know that there are specific homes that serve culturally specific care to specific communities, such as Chinese seniors, have a much longer waiting list than others, because these seniors have fewer choices than a white English-speaking senior. For example, to get into Yihong Center for Geriatric Care here, you can wait up to 8 years, sometimes even 10 years to get that bed. And then are these data actually being collected? Yes, they are. Because when you apply for long-term care, you have to, in the application form, they ask for your language, your culture, your spiritual affiliation, your race. The reason why in healthcare that they do that, because in name, long-term care is supposed to provide appropriate care that would caters to the needs of the client. It's called resident-centered care. So they do collect this data, but this data is not being shared, or it's not being used, or it's not being accessible to the public. And so and how are seniors of racialized background being served? I'm just gonna share with you one example that I personally have encountered. Before I left my job of Yihong Center for 18 years, shortly before that, a senior was admitted. And on the first day of her admission, her daughter was just so happy and so thrilled. She screamed and said, she can talk. She was referring to her mother, a senior, who had not spoken a word for the last few years because she was in a long-term care home where there was no staff that could speak to her. And on the first day coming to Yihong, finally, she was surrounded with familiar faces, familiar culture, familiar language. The daughter said, I didn't know that. I thought she had lost her speech ability because of cognitive impairment. So this is just an example, and there are many, many, many other examples about how racialized communities are not well served by a system that predominantly caters to white English-speaking communities. So are there any other data that are being collected in long-term care? Yes, because long-term care in Ontario have to submit clinical data. And Health Quality Ontario, which is an arm's length body that is looking at quality of care and treatment across Ontario, including long-term care, is supposed to then dissect data and then to analyze it and then actually publicly make it accessible. So you can look at each of the long-term care home, how they performed in terms of where the number of falls, the number of wound, weight loss, depression, use of psychotropic drugs, and these are all, important quality indicator data. However, though, these data are not broken down based on the other attributes. So again, we don't know in each of the home how they perform in specific home, how each of the racialized groups will fare in the home. So if long-term care is not serving the racialized communities, that means many of the seniors from racialized communities have to rely on community care. So are there publicly accessible data showing how racialized seniors are being are utilizing or not utilizing community care, such as home care, nursing, like we're talking about visiting nursing care, supportive housing, day programs, and all that? Again, data are being collected, but they are not being accessible and they are not being distributed or shared. And in fact, when COVID-19, in Ontario, the umbrella, which is similar to the health authority in BC, I believe they are the Vancouver, health authority. Similar here, we have a super agency. So the super agency actually share data. Before they actually publicly shared the data, they actually said that they knew that the COVID-19 had differentially impacted on marginalized groups. So they have some data in their hand, but the data so far has still not been made public. So the missing data in long-term care, right? So who are in and out in the program, who are not in the program, who are on the waiting list, who are not, you know, and who wait the longest and all that, and how well are racialized communities being served, we don't know. And on top of this, there are many systemic barriers in healthcare. And again, I just want to share with you some of my experiences and where I learned about this. When I was in long-term care, of course, we would have to apply treatment to seniors when they get infection, when they have other, you know, comorbidity and chronic disease. And the doctor and the pharmacist would say, well, actually, this is a guessing game in terms of dosage, because the drug research that we have done have never been done on very old seniors. So it is totally a guessing game and based on the experience of the practitioners to apply their experience and their knowledge to determine what is the right treatment and what would be the appropriate dosage for that very old population. Because generally, when drug pharmacy companies are doing these research, they don't have these old seniors in mind, nor do they have women in mind. So we know that, you know, that such as HIV/AIDS, the treatment, in fact, at the beginning, there was so much research done into HIV/AIDS treatment. However, it was found out later that treatment does not work as well in women with HIV/AIDS. So we know that drugs have differential impact on gender, and we don't know about race. However, you know that there are many since the mid-80s. Most of the pharmaceutical companies in the world, we're not just talking about Canada, but in the world, have heavily invested in China in terms of doing drug research for many reasons. First of all, China have more skilled researchers that they produce annually. They are called pharmaceutical engineers. They all have PhD in pharmaceutical engineering. And they have ready access to patients who are willing to try drugs because they have no access. They cannot afford treatment. And of course, these pharmaceutical companies are willing to go to China because they look at it as a huge market. So I often wonder, all these drugs being tested on Chinese, you know, men and women and, you know, and all that, what would that eventually mean for us, you know, for the non-Asian, non-Chinese, you know, and communities beyond China. So, and interestingly, of course, we all know that the treatment modality is very much based in Western medicine in Canada, in Western countries such as Canada. And often the research studies will not involve racialized communities such as racialized seniors. So who benefits from the use of selective data and or missing data? Of course, obviously, in this case, Ontario government. They show you some numbers to justify building these long-term care homes so that ultimately those big chain, privately run for-profit homes can build more. These, as we know, the conservative governments have been shown to have more affiliation and more alignment with these big companies. And then they are not talking about, they are not reinvesting, they are not investing in community care, nor are they investing in other supports to communities. So at the end, racialized seniors, even though they need those care in the community, they are not getting it because the system, the long-term care system, is so racist inherently. And the service providers, of course, will benefit. You know, if you don't challenge them about how well they are doing and serving racialized communities, they sail along. They, you know, they can, and this would include, of course, the companies, the organizations, the management. I mean, I have to say that also the workers, right? The workers will also not be challenged if they have treated the racialized client differently. Corporations definitely benefit, right? As in this case, the big chain, you know, and also not just, I should say, not just long-term care, right? The big corporations in pharmaceutical, the drug company, and all those would benefit. And ultimately, of course, the consumers, predominantly white, English-speaking, educated, higher income, you know, those with better access to services will, of course, benefit. And so, will disaggregated data help address racism in long-term care and community care? Yes, it would to a certain extent, because it would shed light in the inherent inequities, you know, if we look at the issue of access, if we look at clinical outcomes, and then, you know, if data is captured, and I actually should have said this in Ontario, and I do think that probably, as June said, in BC, the frontline workers are racialized, very much racialized communities, and very much being affected by, you know, not just the pandemic, but of course the impact of the pandemic, as well as, of course, racism within the homes and all that. So can you imagine all these, and I have witnessed it myself, right? All these racialized workers being treated as maids, as, you know, as slaves in some ways by the white predominant, you know, seniors who think, oh, you are just, you know, my servants, you know. So yes, if we do collect data, if we do collect, including human resources data, including incidents of abuse, hopefully we would also shed light on the experiences by the individual caregivers. However, the data will not capture everything, as we all know. Again, I'm just going to quote an example of an incident where our resident went to a hospital, and he came back in tears, and he swore he will never, ever go back to an acute care, because in the acute care, he was put on restraint. And so we tried, like, why was this very quiet gentleman, I mean, really, he was such a nice guy, why was he put on restraint? He was not even demanding. He merely asked to go to the bathroom, and the nurses and the people in the hospital did not know what he wanted. And so he became so agitated that, of course, he yelled for help. And because of that yelling and screaming, they put him on restraint instead of trying to understand what he wanted, trying to meet his needs. So, you know, this is an example, to me, is, you know, example of course microaggression, of racism, but this kind of data will not be captured. And it will also not be captured even in a long-term care setting. And it would not be captured in terms of, you know, whether the long-term care home is serving food, the cuisine that is meeting the needs of the communities, you know, a bowl of rice for Chinese seniors, a bowl of congee, you know, or other meals that are appropriate to the communities, to the seniors. Those will not be captured, and those interventions need to be monitored differently. And, you know, just this is my last slide. Will disaggregated data advance this? You know, I think we often, you know, as I heard, as I listened to the presentations from last time, you know, and all that, disparities are often highlighted when we measure the differential impact against some objective indicators, such as, and in healthcare, we talk about social determinants of health, and public health people should be the most conversant on social determinants of health, right? Access to housing, access to education, access to, you know, to income, access to, you know, and education and all that. So usually these will be the indicators, and then you look at, you know, whether people have these access and whether these systems have presented barriers to them. And however, though, in healthcare, my additional comment was like, how do you measure quality of life? How do you measure psychosocial well-being? How do you measure happiness? To me, is very culturally laden. And in Ontario, we talk about resident-centered care, we talk about self-determination, we talk about privacy, confidentiality, and all that. Let me tell you, when we work with Chinese Canadian seniors, these concepts are so alien or foreign to them. And because the whole concept of I as individual is very different with these groups of 80s and 90s-year-old Chinese seniors who grew up in a culture that actually defined we and family as a unit more so than I as an individual. So I think in healthcare, so how do you then measure that, and how do you assess all that? Need to be then fundamentally look at the tools and look at the measurements to ascertain health and well-being. As June said, ultimately, collectively, we need to develop those. We need to structurally change, and disaggregated data would help some, and we need to totally reframe how we are measuring, what we are measuring, how we are measuring the disparities, and ultimately we need to really look at fundamental systemic change. So that's where I would conclude my remarks.
Thank you. Thank you so much, Amy, for the sharing your wealth of experience in, again, decades, I think, in that long-term care and healthcare area in Ontario. And I know that many of the people actually attending today, in fact, one of the people really helped us organize today's discussion. I can see actually out of the corner of my eye in the Zoom gallery, Margaret McGregor has been involved with a group of Asian Canadian Seniors Health Network that was part of it. And I know that many of the things that you've identified are part of the environment in BC as well. Not the same, actually. You've raised a number of issues that actually are differ here. And yet I think the overall points that you're making really do hit home, I think, in a BC context as well. So I look forward to the discussion about how some of what you've presented is going on right now in Ontario. Perhaps some different resonance here, but some of the fundamental issues being very similar. The third speaker we have today is Ellen from Project 1907, and we look forward to Ellen explaining what and why she and several other people felt that there needed to be some self-reported data gathering about incidents of anti-Asian violence during this period with COVID-19, and I think. Again, to me, and this is just a frame right now as I pass it over to Ellen, the absurdity, you could say, of the missing numbers extends to the point where people who are suffering the effects of that ungathered data have to gather the data themselves off the side of their desk, and I think that's a way of picking up a thread that started the last discussion, but also June has picked up and Amy has picked up is the costs and the impacts of missing numbers on the very people that those differential impacts have the most impact. And so I'm going to turn it over to Ellen from Project 1907.
Thank you, Henry. And thank you to June and Amy and everyone tuning in, for making this a priority. It's much appreciated. Before I start, I also want to acknowledge that I am speaking to you from the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I've recently been thinking a lot about the financial impacts of colonization and the need to recognize the intergenerational equity gain of home and land ownership. So that's where I'm at in my learning journey, and I would invite everyone to also consider that in their work. You may notice that I am not on camera. I've chosen not to do that today. I'm going to speak a little bit to that first, and then I will be speaking from the perspective of what data collection looks like from a very, very grassroots level. So I identify as an Asian woman. I'm of East Asian descent. My ancestors come from Korea, today known as North and South Korea, lands that were also colonized and then permanently separated without our consent. As an East Asian identifying woman, I and my colleagues were experiencing a significantly increased level of hate, racism, and violence towards us, especially this year with the rise of COVID-19. So based on what we were experiencing, finding nowhere to report or share about our experiences, we decided to create a reporting center to actually start tracking these incidents. So we're now working with the Vancouver Asian Film Festival on its Eliminate Hate campaign. So we're lucky to have joined forces to be collecting this information. But it's a very grassroots effort. It's a Google form that folks can self-report when they've experienced something, and we have collected hundreds of reports up to this moment. So I will just share some of the emerging trends. Can you see the graphic there?
Yes.
Perfect. All right, so these are the emerging trends that we put together based on the first 128 reports of racism that were submitted to us. And something that was a striking statistic for us is the 70%, that over 70% of respondents are identifying as women. So as a very small collective of Asian identifying women doing this work alone, you know, without any funding or institutional support, we actually really do not feel very safe or supported doing this work in a public way. And that's part of the reason I have chosen not to go on camera today. When we released our infographic, there was a lot of, shock and surprise by people, lots of comments that I can't believe this is happening in Canada. This doesn't happen here. Canada is not racist. And one of my favorite quotes written by the journalist Denise Balkasoon, she says, "Endless surprise at evidence of racism is one of the most racist things about Canada." And I think that really hits the nail on the head. The absence of data allows us to maintain plausible deniability and pat ourselves on the back when really at the community level, racialized people are saying racism is happening and it exists here. So I want to deconstruct a little bit what we mean when we say that data collection processes need to be community-led. I think that's one of the trending terms in discourse these days. Folks are waking up to the idea that it matters who collects the data and how it's collected, and that communities that are affected need to be involved. But I want to ask I want to deconstruct, what does it actually mean for the people who are most impacted to also be the people who are carrying the weight of the work? So from my experience with Project 1907 so far, I can share that I'm now in a very bizarre situation where, I go out, I experience racism, then I report the incident that happened to me on the form that I created. I actively am seeking out supports and resources for myself, while simultaneously trying to support others who have identified that they need support through the form. The work is not paid, so in addition to working a full-time job, we're doing this labor for free and with no resources. As a group, we're not eligible to apply for funding because we are not a registered nonprofit organization.
which actually entails a lot of work. It entails putting together a board of directors, getting an article of incorporation, paying several $100s, getting through a whole other application process just to be considered a nonprofit to be eligible to apply for funding. So even if we're able to put applications in for funding, they often require data in order to compete for the limited funding. So we're seeing that funding often ends up going to larger, more established organizations that can sometimes be less grassroots or less connected to communities. And from our lived experience, we're really seeing that we're trapped in a cycle where people with lived experiences are left to collect data about their own experiences. Something else that's come up for us in our work is that because we've done the work for free, I think people then see it as work that is allowed to be accessed for free. So we've received countless requests from people who want access to the data, and they do not share any information about how it will be used or why they want it. And when we've tried to set some boundaries about that, often we've been met with silence. Even when we've done all this work and we have collected data on our own experiences, it's also often seen as biased or less valid because it's about our own experiences. So I think this means we also need to talk about who gets credibility in our society and what kind of information is seen as valid. It's often people with PhDs, multiple degrees, lawyers, government, police, people who are often associated with white supremacist institutions have credibility and are believed, while those of us who are working on a community level are not, our information is not seen as valid. I recently took part in a webinar led by Tamaki Kano, and they brought up the term credibility gatekeepers. And I thought that was very interesting and wanted to raise it here as well. How is what power and white supremacy maintained through credibility gatekeeping? As an example, I want to also take this opportunity to highlight the work of the Yellowhead Institute, which is a First Nations-led think tank based out of Ontario. There we go. So they recently published this interesting resource. It's called Community versus Indigenous Services Canada Data, the COVID-19 Discrepancy. And it highlights the discrepancies and gaps between data collected by the community and data collected by the government. So you can see on the top there, it says, as of May 10th, 2020, there are 465 reported cases of COVID-19 in Indigenous communities, according to community source data. Indigenous Services Canada is reporting just 175 cases, revealing a gap of 290 cases. We also see in the gray box on the bottom, COVID-19 related deaths, that 2 deaths have been reported by Indigenous Services Canada, while 7 deaths have been reported by the community. So they list 4 reasons for this data discrepancy, among them the continued erasure of the urban Indigenous population. So the reporting by Indigenous Services Canada reflects on-reserve populations only. So the question is, how will we address these discrepancies, and which numbers in the end will be given credibility? All this to say that I really agree with Dr. Francis in that we need transformative change. Like, this cannot be about continuing to do everything the same, but now we're adding the collection of disaggregated race-based data, and that is going to make everything okay. We need to actually be given the tools, the time, and the resources to organize in our own communities. And we need to be believed when we do that. We need to fundamentally change what is considered useful and credible information. And I agree, I really love the term that Dr. Francis brought up around reimagining the research industrial complex. Absolutely, I agree. I also want to take a second to deconstruct what it means when we say disaggregated race-based data. It's another term that's really been, trending as of late. But when we really think about what that means, we need to acknowledge that race itself is a social construct. It is part of white supremacy to segregate groups by race. And Kim McGrail spoke about the double-edged sword of race-based data collection in part 1 of this panel discussion. And I would agree, it is a double-edged sword because we are measuring something that is socially constructed for the purposes of dividing and conquering us. At the same time, data is needed in order to address social inequality. So I think this really begs the question, who is making the racial categories and who is choosing the boxes that we tick? And I think the US Census is a very interesting example of this because racial categories change depending on political, social, and economic concerns. And they have changed, particularly on the US Census. So the term Chinese first appeared on a California census in 1860. And it was added because there were concerns about the large immigration numbers of Chinese people. Chinese was then added to the national census in 1870 and has been put on every census since. It was also the first category that used a nation-based classification rather than a race-based one. And it was all done through the lens of whiteness. So we need to consider that data collection can be used as a form of policing too. I also want to raise the question, what happens when we can't agree on what those boxes should say? And speaking from my experience, the term Asian, for example, is very contested. It includes certain people and it excludes certain people. Someone recently shared with me that there are 2,300 living languages in Asia. So when we really think about what this means, how can the diversity of 2,300 languages be reduced to one word, Asian, in North America? I will end on one more point about self-identification. This is something I've been thinking about a lot recently, especially in relation to the data that we're collecting. If one of the goals of collecting data is to correlate race with outcomes, health outcomes, employment outcomes, etc., then having data on how others perceive a person may be something interesting to measure, and may be the measure that's actually more likely to correlate with racial discrimination. And I think COVID-related racism has been a very interesting and powerful example of this. It doesn't matter what race you are or how you identify. What matters is how the other person perceives you. And if they choose to perceive you as Chinese, you're being attacked in this social environment right now. So I'll leave that as food for thought. And I might stop there because I see that it's already 6:12. So I'll hand it back over to you, Henry.
Thanks, Ellen. And thanks to all three speakers for sharing their comments, and then as well being so mindful of the others too. And I noted that all three of you, said that you were going to stop precisely to allow others to speak. And this moment is actually to allow all three of you now to speak, and maybe again just to say anything that that is sparked by one of the other speakers' comments and things, or whatever you feel you want to add. So why don't we go back to June, to Dr. Francis, to sort of start us back in the kind of discussion stage of this.
Yes, wonderful presentations. I'm so glad I'm here for it. Listening to the comments from the other two speakers, there was so much richness, so much interest, so much to say. I just wanted to pick up on a number of things. Well, let me just start at the end then with Vicky. This whole idea, some really interesting points that I think I share through my own experience with both of the speakers. So maybe I'll start with Amy first. So this whole idea of how we hide data, and therefore it ends up in places where we have institutions that are designed for certain groups of people that takes on all the normative aspects, such as individualism versus who is the me and who is the we, okay? Strong emphasis. And I remembered as my aunt lived with us until she was the age of 98, right? And I remember two things that really struck me. First of all, we did not feel we had a choice. See, because when we looked at the institutions, it was to us a form of extreme violence. I mean that to my aunt, to live in a place where she was not going to get food she knew anything of. She had actually not lived with me. But here is where the whole data and no data, I could not get any way to find out if there was a place. Is there a place where she might feel that she could get some food? And then they would tell me I had to use these various services, all of which serve food that didn't look familiar to a Jamaican and at her age could not eat. It goes on from there. So the lack of race-based data and how it lands itself in seniors housing, in a variety of institutional setting, and the ways in which the failure of the system to really reveal itself and its true nature in data means that some people forever don't end up with the kind of care, and we don't even know it, right? It's hidden. So we don't even know how they're faring. We don't even know what well-being means to a Chinese person. We don't know what well-being means to a Jamaican, because we're measuring all the wrong things. And I remember the final thing I'll say on that point is when they came to my house once, and because she had fallen, they wanted to take her into an institution. And she looked at them and said, "You are taking me from my family because I might fall? Did I ever give you the impression that was my priority?" She said that you would take me away because I fell. I would rather fall with my family than live forever wherever you're taking me to. But it's a whole system did not even have the capacity to deal with it. What I also wanted to say is how much I forgot Project 907. I just want to make sure I got your name right.
Ellen.
Okay, no, Ellen. That's what because I didn't see you, I was trying to make sure I had the right person, and I'm not. You're the same person on the bio. Ellen, you made some amazing points about free labor, that we are left to collect data on our own. I have worked with the Hogan's Society, where we worked because we knew we guessed from everything we knew, from our lived experience, that there was an overrepresentation of Black homeless people in Vancouver. Now, Vancouver is an awful place for Black people because they don't think we exist at all. So when we said Black people are overrepresented, and but they're doubly stigmatized on the streets, and they don't feel welcome in the shelters elsewhere where they're stigmatized again. And they said, prove it to us. Where is the data? Oh, we didn't collect any. And then what that meant next was that the community of volunteers, Hogan's Alley, completely volunteer society, now had to collect the data. But then it's worse than that. They had to work with the city and the province to try and figure out how to collect the data. And then when it came up, it wasn't used. So it's a whole labor of freeness. And the question is, who, when you brought up this thing, Ellen, about who gets to collect the data, what does it mean when we collect the data when we're not resourced? And then that free data now is, other people feel that it should be freely accessible. And then when you give it freely, you get challenged as well. And they ask you, how do we know it's not bias? Right? Prove it to us. So we're constantly proving, we tell stories. We go to places, we're bearing our souls, this and that, trying to just get attention because the data does not exist. Sorry I went on, but I was just really fascinated by both presentations.
Thank you, June. Yeah, it's interesting, the aging in place that your aunt, you know, the desire I think we see in so much of culture of appropriate care is actually a desire to not go away to a long-term care home, and echoing what a point of Amy's points is, that's not the normative, ideal. Is aging in place in situ is actually one of the things that's come up again and again in discussions in British Columbia of what, when you actually ask seniors to, from various racialized communities, or those that are not the normative, ideals of what would make them happy, aging in place comes up again and again in those kinds of answers. So thank you, Dr. Francis. Amy, we'll turn to you to kind of.
Actually, because I'm looking very mindful of the time. So I'm, if it's okay, I'm going to pass so that hopefully we can get some questions from the audience, because I think June has really summarized, this really well, and really captured the essence of the presentations from Ellen and mine, and of course hers. So I'm going to actually, hopefully we can get some questions from the audience, if it's okay.
Thank you so much, Amy. That's really appreciated, and we'll check. I mean, Ellen, I know just gave her presentation, but Ellen, do you want to add anything while? And I'm going to ask Sarah and Rob and Carolyn to kind of start to pour through some of the questions, and perhaps while I check with Ellen about whether she has anything that she wants to add.
I'll just very quickly add one thing about when Amy was speaking about the healthcare system and pharmaceutical companies, it triggered a memory that, just that I've come across in my research about the data that's been collected in the US on this. So what I found in my research is that data in the US has helped reveal that the more money the average doctor receives from opioid makers, the more likely they are to prescribe opioids. And I just wanted to raise that in the context of the overdose crisis that we're facing in Vancouver right now. And something else that I found really compelling was that something as small as a single gifted meal can tilt doctors toward prescribing more expensive brand name drugs. And I think that's significant. In Canada, it's just an example, I think, again, of the erasure of data in Canada. We don't know how much money pharmaceutical companies give to doctors or healthcare providers. And that is an example, I think, of something that would be useful information to have, especially in the middle of an overdose crisis. So yeah, I'll just offer that and then leave it for questions.
Thanks, Alan. And so I see. Let's see. I'm going to ask Rob and Sarah and Carolyn to bring other questions in. But I'm actually struck again in terms of both the previous panel discussion and this one, how it's the missing quality, and its effects, but also who has, control is too strong a term perhaps, even though right now it seems to be that is in the control of certain people and certain institutions. But this sort of vision that I think June brought out, and then both Amy and Ellen, what would it be to be able to resource data collection, in the context here in BC, and whether you have any ideas and suggestions right now about, some practical ways right away. It's like, okay, if we've got resourcing, what would you like to see, done right away in terms of how that resourcing is shared, and how the data that comes out of these processes are also shared. So a sharing economy, so to speak, where data is not in the hands and paid for. And I loved your phrase in terms of the research industrial complex, because again, being faculty at the school on the other side of town, it's you run into this constantly. And so yeah, I'll just throw that out as one of the possible questions to answer and think about. Yeah. I'll also introduce one. A specific question to Ellen is: has your group found a way to determine how to charge for the use of your data? I mean, it's related to what I just brought up. Has your group decided how your data is to be used? Again, maybe that's tied to, if the information that is gathered is an asset and a resource and something that has a value and is not devalued, so to speak, by who gathered it and because it's community source. Do you have some ideas, to share about how those processes can be basically best practices for how to do these things? Ellen, I don't want to put you on the spot, but the question was actually directed specifically to you.
Sure, I can try to answer, and I would invite the other speakers to jump in as well. The short answer is no. This whole project emerged out of a need based on our lived experience. So we might by no means have all the answers and all the policies and procedures in place. What I will say is that more than money, I would like to see the way that we relate to each other actually change. So, we are likely to engage with you if we've established a relationship of trust. Asking for free information as our first interaction is not going to build a relationship of trust. So I'm interested in knowing why is your reason, what is your reason for building this relationship? Do you have a reason to attend to this relationship? Can you follow through once you've heard the information? These are the kinds of questions. How will you respond to the needs? How will you demonstrate that you care? I would like to know those things before, and I think we really need to talk about those things and talk about how we change the way we relate to one another rather than putting a dollar value on data.
Thanks, Ellen. June or Amy?
So yes, so actually CCNC, SJ is working with a partner in Toronto together with Legal Clinic, AV's group, and actually Vancouver, CEN, on a project that is funded by the federal government, which is collecting data from people who experienced racist assaults and abuse and all that, be it online or in person or as witness to these incidents, and very similar to what Project 19 is doing. So the www.covidracism.ca is the website where we are encouraging people to report for, particularly in an Ontario area. So what we are going to do with that data is to then review and see if there are trends and if there are recommendations that we can make to the policymakers, to the decision makers, to see, in terms of addressing these racist incidents. And so the issue for us is, in fact, I totally echo what Ellen is saying in terms of sharing data. First of all, that the data ultimately, for us belong to the people who generously share and painfully share that information with us. And what we are trying to hopefully do is to respect that data by hopefully advancing changes that would impact on, and reduce these incidents from happening. So for us, we are not about to share data in terms of, any group, just like I said, come out and say, or even government, we're not going to share, but we hope to then to see if there are any analysis that we can derive that can be shared, and whether recommendations that can be shared and hopefully help and have allies to help advance and push for those recommendations in terms of systemic change.
Thanks.
That's really interesting. I just wanted to add, thank you for that, Amy, for hearing how you're handling this data, because that is certainly an important thing that emerged, and we realized we didn't really have good ways of coming to grips with this. I just wanted to add a couple of things. One is that my experience working in a number of settings where people are vulnerable has taught me the importance of really starting over, okay? So I think I know what community well-being looks like, okay? But when we started to work with Nora Hendricks' place, and we were working with a population of people who had been previously homeless, who had felt doubly and triply isolated and impacted, one of the things that became obvious, and then we also had to figure out how they felt about race and their exclusion, and also questions, do you actually even want to live in a place with everybody else or many people who look like you, a racial ghetto maybe, right? So these are all the ways in which we had to start over. And I'll give you an example. There's something called, I forget, it's just slipped out of my mind. It's that VAT. It's the VAT is the thing that is used in the sector. It has been developed a long time ago. It's a vulnerability assessment test that they put out. And we looked at it as Black people and were mortified. We had a coronary because we were looking at asking people who we know have experienced triple levels of exclusion, racial exclusion. And then we bring them in and say, to white people who they're not clear why they're asking them that question, please tell us how vulnerable you are. Tell us every horrible thing you have done, and then we won't even bother to tell you how we're using that data, by the way. We don't know, you don't know coming in if you need to be more vulnerable or less vulnerable, or maybe middle vulnerable. We don't give you any of the context. We just simply bring you in and ask you to give us your entire vulnerability. And we pointed out that we went question by question. And what I realized in the end, the protocol, how you ask people about their race when they've been racial categories of exclusion is different from racial categories of inclusion. If, for example, you feel you're going to be stigmatized by hate crime, you're certainly not going to answer unless you are clear that it is in your benefit to answer. So my feeling is we need to go back to first principles, center the voices of the people who are affected, trust their perceptions of their priority, define the outcomes with them, and also work with them to come up with ways to measure it. For example, at Nora Hendricks' place, they kept asking in other temporary modular house, how do you feel in the neighborhood? For many Black people, the neighborhood is not a place of welcome in. So they're not expecting to be welcomed into the neighborhood. What they want to know is that if you want to know how they feel connected is, how have you feel connected to the rest of your community? So they were asking them about neighborhood questions when they were trying to get at belonging. But for belonging with this group of people, it came from somewhere else. And so the intervention then is to connect them to not the neighborhood necessarily, but to the places of belonging. So my feeling is that we really have to reinterrogate power. We have to put the people who are affected in the middle. We have to find ways of reimagining what these questions look like. What are we trying to accomplish with people, and then work with them and trust them. They really do have the wisdom of their situation. They truly understand what's going on, and we need to have ways to work with, alongside, walking with people, not creating a power structure of hegemony of information over them. And finally, when we give the results, of course, it's theirs first. They gave you the power, you need to give it back and make sure it's useful for them before anybody else gets to touch it.
Thank you so much. I'm mindful of time, and that we've asked a lot of the speakers already in terms of sharing their ideas and the time. And I think just as a from the moderator role, we've heard quite a few, I think, very strongly emphasized themes: the co-creation of the process in which knowledge and information is gathered, not objectifying a group of people. And and it's interesting how something that still gets talked about, and going to something that Ellen talked about, objective. What's objective, knowledge, as if it's better to make, a set of people an object, and then that's superior knowledge. And that goes to the idea that knowledge that somehow is co-created or comes from a group, a community, is biased. And so and how oppressive that actually, this idea of objective versus biased, has been in terms of academia, the research industrial complex that I think June mentioned. And so co-creation of the knowledge, sharing of that knowledge with the people who it's been collected from, and in terms of not just who can use it, but on the appropriate uses. And that is, in fact, a relationship, going to something that Ellen raised, that this is not about coming in and doing some research and then you run away, the hit and run research and hit and run data collection, that this is also about trust relationships, of collaboration and co-creation of knowledge means also there has to be an ongoing relationship and accountability for how things are used, and an ability, again, for people to have a say in how this is used. And it's very different in some sense in these abstract notions of ownership, that you sign away something and then it can be used by an institution in any given way. And again, how privacy is in fact and the use and the proprietary and the ownership of knowledge is often in fact made things worse in the context of a lot of the discussion. So I just wanted to again allow all the speakers to, if they have any kind of final maybe things that they want to add, that they feel that it wasn't raised, or just any kinds of finals. Doesn't have to be a summation. Anything you just wanted to add to the conversation before we before we close.
I just, based on the premise that I raised around, health, particularly population health, determinants of health. And I saw one of the questions from one of the participants was about, so how do you even start doing this work of transformative data collection and all that? So I think, like forums like this and finding allies, right? And as Ellen and June all said, like, we really need allies, and in health, and unfortunately the power structure cuts across all sector, right? And however, we need to be mindful of that power structure, but at the same time we do need to work with allies, and in Ontario we do have like very much committed health advocates who subscribe to an equitable, framework, really grounded on population health, because we know racism is a determinant of health, right? So to find those allies in our struggles, in our collaboration, would be very important, while recognizing that there is always this power struggle. And sometimes, actually, to tell the truth, it is even more frustrating when you think that you're working with progressives, and trying to get them to understand, if you understand, socioeconomic data, sort of disparities, why don't you understand racial disparity? Sometimes, you get that frustration. However, I think, and just like, I'm working with women's groups, right? The fight for women's rights and, and feminist movement. I mean, so we know racism cuts across, right? So, but we still need to identify those allies and identify those people and work in solidarity, particularly, of course, racialized communities working, together, in fighting against racism. Yeah. Thank you.
I just want to underscore that. I have to jump in and say, I really like that last piece. I think we need to work in solidarity. I think we really need to think about that. I think we don't all understand the ways in which the system has actually pitted us against each other. And this is the final point I want to make. So, resources. If your account is higher than mine, you get more money. Okay, that's, you know, I'm just saying, this is how this works in our society. So what happens next? Instead of us working together to say, this is not how it needs to be. A small community in this place is disproportionately affected. It's not about how many of them are over there. It's the nature of the problem. And let's work together, because in another space, we're gonna have to work with you on a specific space you want. But we don't know how to do this because we have always been intersected by somebody else who has us at the periphery. So we're like this visible minority around here, and we often find ourselves at odds with each other when we don't want to be. We're not, you know, I often find with this data, sometimes I don't even want it, because then it means that some other groups that's very worthy, is not gonna get the money. So we need to think about new forms of relationships, I think, new ways of sharing, learning from each other, the crowdsourcing, you know, Ellen is doing, what does it help inform how we collect data? Maybe we have values, we can share data. Let's try and think about ways where we can work more laterally with each other, because I think we share very similar perspectives, very similar issues, and I think we're going to be much stronger together.
Thank you, June. Ellen, can you?
I mean, I don't think I could say it any better than that. I just want to say thank you to the folks who organized this. Thank you to June and Amy for your thoughts and for sharing. And yeah, just thank you for the time and the space for this conversation.
And I'll just echo on that and say, I think that is actually a great way to sum it up. And next steps, and maybe that is the perfect answer to what are the first concrete next steps, is to actually, you know, again, within race and racism, I'd rather we talk about the structures of white supremacy and how it arrays, going back to one of Ellen's points, arrays these various peoples as separate races, and then does pit, you know, them against each other. And data, in some sense, actually can be counterproductive to those alliances, exactly in the way that June has raised, and we've seen it in practice actually again and again. So thank you so much for raising that, June, in that very powerful way. I want to just, you know, everyone join us in thanking June Francis, Amy Go, and Ellen from Project 1907. I'm very mindful of that what didn't come up was actually the Project 1907 refers to the anti-Asian riots of 1907 and a history of racism and exclusion and white supremacy, and how so much of the comments and remarks and insights and knowledge that was, and experiences that were shared tonight by all three of the speakers are an ongoing reflection of that history. And that history didn't end, that Canada didn't stop being racist, and one day we all magically stopped, you know, as if this was some kind of a fiction. And in fact, it's the systemic racism that I think we still need to deal with was really raised and surfaced again and again by the three speakers. So our thanks collectively for helping us, you know, think about these, and hopefully this will also help shape the attempt to change the way we, you know, collect data and use data and share data. So thank you to everyone. Again, I'll thank the speakers, but also the Langara Center for Intercultural Engagement, the Sun Yat-sen Chinese Classical Garden, and Chinese Canadian Historical Society of BC for helping organize this, and all six speakers. I look forward to, you know, the next steps of taking some of these, you know, incredibly important ideas and actually reshaping how we do things moving forward. So thank you again to all of you. To everyone else, thanks for participating and coming in, and we we hope that this has helped some of you think more deeply about the sectors that you operate in and help transform the world. So thank you and good night to everyone.